Hi everyone, this is going to be a new video for Aura's Wellness. At the time of recording this, it is October, so we'll take the skeleton theme and focus on theories of bone growth. This topic was inspired when I was at a conference last month. A woman who was a myofunctional therapist stood up and explained her frustration, shared her frustration over the fact that her husband, who's an ear, nose, and throat doctor, does not give her much credibility when she tries to explain that her work in influencing how a child might swallow or function is influencing the actual bone and facial growth. So let's dive into take a closer look at how I would explain that if I were to talk to her husband. Hope he finds his way to this video. So not up for debate is the fact that growth is influenced by several factors. We have genetics, which is the actual kind of code that exists that our biology follows to determine how we will be designed. And then from that code, there is something called epigenetics, which means the same code actually exists, but maybe we skip a few pages here or there, or we skip a chapter. And so there might be a slightly different result. And epigenetics is influenced by maybe what we eat or various factors that just result in a slight variation of that code. And then our environment. So physically, how we posture ourselves, or chemically, on a chemical level, looking at different hormones or otherwise, it's going to all have some influence over how we grow. So when we look at specifically just genetic theories, up until the 1960s, it was often kind of the main theory of bone growth was that the bone itself kind of determined that the coding was all coming from the bone itself. And that theory kind of was disproved in favor of some of the other theories. Cartilage, we now know cartilage is often a tissue of the body that creates a scaffold, and it basically kind of almost creates a precursor to where the bone is going to develop, and then the bone then kind of fills that in. So that's an oversimplified explanation of it, but that's kind of the process that takes place in our bones and our body. And then another interesting thing to think about is that's kind of a separate theory is how much does the soft tissue of our body play a role in determining that bone growth. So a way to think about that more concretely is maybe thinking about as the brain grows, it's putting on some pressure that could be influencing how the skull grows. Or as our eyeball is growing, is that also influencing the growth of kind of the eye socket, the bones that create the eye socket? So those are kind of genetic theories. But then beyond that, looking at kind of mechanical theories. So this first law, Wolff's Law, is kind of the leading explanation when we think about a lot of conversations that surround osteoporosis. And in a way, it is kind of can be kind of a use it or lose it philosophy, for lack of a better way to think about that. But that's the whole idea behind weight training or doing some sort of exercise to strengthen the bone, is that the bone is going to grow in response to the stresses that are placed on it. So that's why we want to make sure that in order to keep healthy bones, that we're doing some sort of exercise that's in a way putting stress on the bone. Another way to look at that same concept is to think about within the mouth, This picture on the right shows what's called tori. Tori are these little bony bubbles that grow, and it's now considered kind of that they grow in response to forces so that the bone actually strengthens itself when it needs to, if the forces on the jaw are maybe not imbalanced or kind of due to the tooth position, or if clenching or grinding habits are taking place, then the bone kind of senses that it needs reinforcement and it grows. So we'll jump down now to consider functional matrix theory, because that is going to have the most relevance for what the myofunctional therapist was trying to explain to her husband. So that is when an individual breathes, chews, swallows, or speaks, the tongue and pharyngeal muscles exert various pressures and forces on the developing craniofacial bones. These forces can stimulate bone growth in specific areas or influence the shape of the facial and cranial bones. So there you have it. That is the theory, and that is kind of spot on when it comes to what she was trying to explain. So to take that theory and try to make a more concrete example of it, we're going to look at one specific cartilage area called the spheno-occiptal joint. This is the area, so it's cartilage. So, when we're younger, it is the precursor to some of the bones that develop. And then what will happen is it stays as kind of a growth site. So as our skull is growing, there is more growth that takes place at that joint. And that happens all the way up until kind of early to mid teenage years, depending on the gender, whether you're a boy or a girl. So spheno-occipital, that is joining the sphenoid bone with the occipital bone. So the sphenoid bone is this bone up here, and then it meets up with the occipital bone that is kind of the base that connects in with the spinal cord. So this is just kind of a side-by-side, so you can see what area of the skull that is, and this is kind of overlaid so you get a more cartoonish view of what that looks like to have the joint, the cartilage space in between the bones, and where that lines up. So now we have to think beyond the bone, what else is going on in that area? So I've gone ahead and again indicated the approximate area of that joint space. And now we're looking at the tongue, the soft palate, and then we've got kind of that airway tube that we breathe through, breathing in air through the nose, and it goes down here. So again, seeing that kind of rendered and laid over into an X-ray form. So the best way to demonstrate this is going to be, I'm going to drop a link in the video description here for this tongue in an MRI machine. There are a variety of videos. You can kind of go down a rabbit hole and watch like opera singing and a variety of different things taking place. It is pretty wild to see these muscles in lifetime action. So pretty cool. Definitely that is the homework assignment of this video, is to watch that and see. But the area that I really want you to hone in on is kind of this area up here where that joint is that I was just talking about. So you kind of follow in and go towards the back of the nose, up above the tongue. And again, this is kind of just the throat area where that breathing space meets up. So one thing to take a look at here is all of these muscles that are at work in that area. So we've got a lot going on in this space specifically. And my hope is that you'll see from the video when we're swallowing or speaking that a lot of pressure is in fact going up into this area. So let's again, sorry, corny joke here. I don't love to dissect celebrity faces here, but I think Tom Cruise can handle it. So I've selected Tom Cruise. But we're just going to take a moment to recognize that asymmetries of the face are often going to be a result of functioning muscles that maybe were out of balance during development. So I think that that's an important thing to look at, is kind of what happens in cases of what we would refer to as dysfunction. And that kind of gives us another perspective on all of this. So looking at what happens when growth goes well, but looking at what happens when growth might not go according to the kind of genetic code book or what we think would have been pre-programmed. So this is looking at a functional example, possibly. I can only guess that it was functional, but one thing that is a little more concrete is to look at what happens with genetic growth when genetic growth is not going according to plan. So there is a term called achondroplasia. This is a defect in cartilage, so that little disc specifically that we were looking at, but other cartilage in the body as well. The cartilage is formed, but it does not convert to bone like it is supposed to. And a common situation that is recognized in this situation is what we call dwarfism. I think it's really important to just look at this for a second and recognize that specifically in these cases where something went off track, the skull does not develop as it should. And as a result, the base of the skull doesn't lengthen and the rest of the face does not do the development that it ideally would. So I think it's interesting to look at that and how that affects breathing, nasal breathing, and mouth breathing. And coming back to the fact that we've already established that the tongue position, when the tongue is in the right place, that's a soft tissue force, a functional force that should be in balance, that results in a nice arch shape of the palate. And when something's not happening correctly, when our tongue posture is low, if we're mouth breathing, something's off, then we tend to get these tight constricted arches. So this is a way to see that, there's soft tissue that isn't doing what it's supposed to, and the bone itself is affected. So what's to prevent us from looking at that when we see it in an example like that, and looking at it in a more three-dimensional way with regards to what's happening with overall skeletal and facial growth? Hopefully that just was a little recap, overview, introduction, whatever level you are entering this conversation with. But hopefully that was some information of interest to you regarding some bone growth. So happy Halloween, happy Dia de los Muertos to those who celebrate. Coco is a fantastic movie. If you haven't seen it already, it's always a must this time of year in our household. So thank you for tuning in, and I hope you learned something.